the idea, some speculation, I should say, that the RFK Jr. is looking to link autism to Tylenol when it comes to the use in pregnancy. Your initial reaction to that speculation, which we should inform our global audience, Health and Human Services has denied.
So I'm waiting for the report because I think everything else is speculative about the report. There was a very interesting study, however, that did come out 2 weeks ago that did a review of 46 different studies that looked at the relationship of Tylenol with a whole different neuro diseases and children, looked at autism spectrum disorder and looked at ADHD and looked to see whether there was a relationship. And the review was actually quite well done. And they did see a trend towards a relationship with Tylenol in certain ones of these cases. And they did a good job reviewing them. And I just ask your audience to take a look at that. It was just published 2 weeks ago.
Well, with that said, there's been a lot of concern, Doctor, about the framing of this report because scientists have tried to explore this connection before. Should the Department of Health and Human Services be looking for a specific cause of autism, or are there more nuances to this story?
Well, I imagine autism, because it's a spectrum, is as complicated as even what we see with long COVID, which was also a part of the discussion yesterday. And that's why I'm looking forward to seeing what they really talk about. Do they talk about the 20% that is genetically related and using AI to really understand those genes so that we can understand how it can reverse? Because what you're really getting at, if we can understand the different causes, and there may be 5, 10, 15 different causes creating a similar disease, then we can start to tackle how to make these children better. And I think we all want to do that. We all want to not only decrease the rate of autism, but ensure that children have all the opportunities that they could have. And modern medicine can do a lot of wonderful things. So I think key to that, though, is finding out in these different children what the causative agents could have been.
Certainly developments that we're looking to continue to follow as they come out. Dr. Birx, I'd like to pivot the conversation back to the hearing and some of the commentary we heard on Capitol Hill yesterday from RFK Jr. A lot of concern about vaccines and the availability of vaccines. Is it clear whether whether the need for a COVID vaccine, if that's even available, should I or anyone actually need it? Is that guidance clear?
Well, the guidance hasn't been clear in general across the board sometimes in the United States. And so there's a really great publication out at the UK. So I worked in global health, so I spent a lot of time looking to see who has explained this the best. If you go to the Green Book that the UK government has put out, it really lays out all of their decisions related to vaccination with COVID. You know, they stopped vaccinating healthy children under 5 in 2022 because of the high antibody levels. So they do the science, and they included all of that in this Green Book. And so it really lays out in a very careful and detailed way about decisions that they have made. I think we need a similar thing to the Green Book that lays this out for the public, exactly all of the data that is leading to some of these conclusions. Yes, many countries have decreased vaccination of healthy children, some all the way up to age 16. But all countries have continued to tier the high-risk patients and make it very clear, and that's what's in this Green Book. People who over 85, people with significant conditions, and it goes down tier by tier by tier, mentions also pregnant women. So I want to reemphasize that. We're in the middle of a surge right now in the United States. Wastewater has been going up for about 2 weeks. So if you're in a multi-generational household and you have an elderly living with you, now is the time to be testing, because most of the disease in children and young adults is really what we call subclinical. People don't know that they're infected and could pass it on to their elderly grandparents or great aunts that are living with them. And so all of the things that we learned to do, as well as vaccinating people, need to continue. But we also need to really follow the science and get the data to really clearly show who should be getting vaccinated and who no longer needs it.
Well, of course, you had a front row seat to Operation Warp Speed, Doctor. A lot of our viewers and listeners remember all the days you sat in the White House briefing room as we talked about this, and of course the impact that the operation had on so many people, curbing the pandemic here in the U.S. and around the world. This came up during yesterday's hearing. Senator Bill Cassidy asked RFK Jr. about this. Of course, Cassidy is also a medical doctor. Let's listen.
Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also were
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. And it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access.
I wonder if you see RFK Jr., the secretary, arguing with himself on this, doctor. He was also asked how many Americans died during COVID. He could not answer, and was asked specifically by the senator if the COVID-19 vaccine, if the vaccine from Operation Warp Speed actually saved American lives, and how many. He wouldn't answer that either. What message is that coming now from the Department of Health and Human Services?
Well, I think we all know how important the COVID vaccine was. It was scientifically, critically studied to prevent severe disease. I think where people started to get confused is when we started to make potential claims that the vaccine did more than what it was studied to actually show. And remember, all of those original studies, we didn't test patients unless they had symptoms. We only looked for disease. And so we don't know how many people were asymptomatic. We don't know about protection against infection. What we did know about is protection against severe disease. And clearly, if you look at the mortality in individuals over 75 before vaccination and after vaccination, there was a dramatic difference, even through Omicron and Delta. So yes, the vaccine was highly effective for what it was intended to do, which was prevent.
Shouldn't the health secretary know that?
You know, I'm not sure that there's so much confusion about the COVID vaccine, what it was studied to do. I just want to make it very clear. It was studied to prevent severe disease, and that's what it does. And then I think the question is, well, who's susceptible to severe disease and who should continue to get the COVID shots? And I think that's what needs to be clearly laid out to the American people.